Hi everybody, my name's Kim Brewer and I'm the practice manager of Northampton Area Pediatrics. We wanted to make you a little video about what's going on in the office these days. First of all, we wanted to remind you that NAP remains open 7 days a week to provide care for our families and our patients. It's really essential that well visit care is not postponed during this time, especially at ages where patients need vaccines, which is under the age of 2, 4, 5, and 11 years old. We also wanted to let you know we're offering telehealth visits virtually at your convenience. Telehealth is now available for sick visits, well visits, and behavioral health visits. When you arrive to our office, you're going to see the screening sign. You'll be asked screening questions on the phone and again once you arrive. These screening questions change with CDC recommendations. We ask that only one healthy adult accompany the child into the office. Now, most patients will enter through the front door. For patients with coronavirus symptoms, or if the adult accompanying the patient has symptoms, you'll enter through a separate VIP entrance in the back of the building and be seen in a separate walled-off section of our office. This will allow our general waiting room to be free from people with COVID symptoms. Anyone entering our office without a mask will be given one immediately upon entering our office. We wanted to let you know that our office volume has reduced significantly, so time spent in the waiting room and contact with other patients is minimal. We don't really have lines at the front desk. We have an empty waiting room with ample space for social distancing, and anyone in the waiting room is wearing a mask. We removed all toys and books from our waiting room and exam rooms, and all surfaces are cleaned hourly. All NAP staff and providers are wearing masks while in the office and practicing social distancing. We have a sufficient supply of personal protective equipment and are knowledgeable on how to use it. Providers are working rotating weeks in and out of the office to limit exposure. While providers are out of the office, they're seeing patients virtually via telehealth for both sick and well visit care. Telehealth visits are also available with our behavioral health clinicians. Now, there are 4 providers in the office each day. One provider is seeing patients with COVID symptoms in a separate area of the office. This is the wall that shows you on the back side of that is where we see our COVID symptom patients. On this side of the wall is the remainder of the office. On this side of the office, 2 providers will be seeing well children for their annual checkups for those patients at ages when vaccines are due, which is the current AAP guideline. The one additional provider is seeing all other visit types, including non-COVID symptom sick visits, rechecks for ADHD, rechecks for asthma, chronic illness follow-up, or other common childhood health issues. We're now going to head back outside so I can show you the VIP process. If you call our office for any type of appointment, you'll be asked the COVID symptom screening questions. If your child or the adult accompanying them has a positive symptom screen, you will be considered VIP. Patients and families will also be asked immediately upon entering our building the same symptom questions again, and will be immediately sent back out to their car if they screen positive, and all surfaces are cleaned immediately. If you're considered a VIP, instead of entering through our main entrance, you're going to drive in the office and you're going to park around the back right-hand side of our building. So come on, I'll show you right now. When scheduling a VIP appointment, you'll be given a phone number that you're going to call when you arrive and notify us that you're in the VIP parking lot. There's 4 dedicated parking spaces that you can park in and a separate VIP entrance. A dedicated VIP clinical staff member will come out to your car, give you a mask, and escort you directly to the VIP exam room. I also wanted to give you a little update on COVID testing. We do have COVID testing available, but we are requiring that the patients are evaluated by the provider prior to obtaining the COVID test. So if you're concerned about COVID, please call our office to schedule an appointment. This can either be done in office or it could possibly be done virtually. And if you get a test ordered virtually, we have a process so that you can get swabbed in the parking lot and don't have to enter our office. We want to thank all of you who supported NAP, for we've received masks, gowns, other protective equipment, as well as frequent words of appreciation for staying open and for providing care during these difficult times. To receive our weekly COVID newsletter, text NAP to 22828. That's NAP to 22828.